Okay.
Anyway.
Lots of hearts if you guys think that Dr. G should pierce the gigantic ear. Oh, yes. Danielle says yes. She thinks you should pierce the gigantic ear. Maybe we should do gauges? Maybe?
You could do gauges with that, totally.
You could do gauges with that. Totally do gauges with that.
Do we have a...
Oh, she says no gauges.
Uh,
Danielle's anti-gauge.
All we
Yeah,
need is an
there we go.
18-gauge needle.
Just cartilage. We'll go through the cartilage. It'll look cool. We'll put a big hoop on the bottom and then put a stud up in the cartilage there. Yeah, we'll have to do that. Yeah, like we'll get around to that.
Absolutely.
Henry J. 44, thank you for joining us for this Ask the Doctor with the gigantic ear. If you haven't seen it, this is the gigantic ear that came in the mail. And no, there was no kidnapping. It's just from a Avalon Hearing Aid Center. That's what it's from. So thank you, Avalon Hearing, for the visual aid for today's Ask the Doctor. Should we tell people the different parts of the ear? Boy, it's really right there. You'll get what we call in Northern Ireland cauliflower ear. He thinks everybody who gets piercings there gets cauliflower ear. Yes, that's what I told my 16-year-old when she got it, and thankfully, no, she didn't get cauliflower ear. So you guys who don't know what cauliflower ear is, the cartilaginous portion of the ear here, where there's cartilage, that's why it's called that, there's very poor blood supply in the cartilaginous portion of the ear, the really hard part there that gives it form. And if you get an infection in that, which you can from piercings on occasion, there's very little blood supply to help fight the infection. The infection just eats away at the cartilage and you get a deformed ear, sometimes looking like, I guess, cauliflower. Somebody thought it looked like cauliflower, so they call it cauliflower. You see it in wrestlers who don't wear the big padding around the ears. That's why they have headgear for wrestlers, to protect the ears. Protects the head too otherwise, but the ears are a big part of it. Rugby players get cauliflower ear, yeah. What about the little part inside her ear? You must be talking about the tragus here, this here. Also, again, there's cartilage in there, and that also is more vulnerable to infection if it gets pierced. That's why piercing in the earlobe, where there is no cartilage, you pinch that and you can feel that there's nothing hard in there, and then just above it, you can feel where the cartilage starts, and the antihelix right here in this portion. This part, you don't so much get the infection problem. If you got an infection, it wouldn't go to the cartilage. Anyways, thank you for your scopes. That's from Henry J. 44. Thank you, Henry J. 44. We are glad to do the scopes, and we're glad that we're getting back to a little more regular on them. Danielle, you did what once? Helix, more common than antihelix. The helix being here, the antihelix being here, the tragus being here, the antitragus being here. For those of you who don't know the ear anatomy, had to pull it through my ear. Danielle said she had to pull it through her ear. Had to pull what through your ear? Oh, the earring. Had to pull it through your ear. You mean like from one side to the other? No, not from left to right. No. From front to back, I'm assuming. That sounds awful. That would do terrible things. That would she says yes.
Sounds painful.
Because it was a fish hook? Is that why I had to go all the way? Because it was stuck? I think I'd do whatever it took to take it out the way it came in rather than going all the way through. That sounds horrible. Terribly painful. Sounds like something traumatic. Okay, so let's see. Where are we here on our counts? Danielle said it hurt bad. I've had people come to the ED with stuck earrings. This is Laura Ruth.
Wait, ED was stuck in?
Emergency department, not erectile dysfunction. And Danielle says, my dad had to do it. Again, referring to the earrings, not, never mind. Dr. G is laughing. Oh, look, we have, of course, always our friend Jessica, who also periscopes. Again, your periscope is.
Oh, goodness. I don't periscope that often.
Oh, she's not periscoping
it's
that.
Jessica Marino, 6/20/14.
Jessica Moreno, 6/20/14?
Yeah.
Oh, when they got married, that's right.
6/20/14.
Yes, ED in Northern Ireland. And so he sees lots of action up there in the ED. Oh, and look, Danielle says, hi, Jessica.
Hi.
Sure, she's giving you a smiley face. Isn't that nice? Do you know Danielle?
I don't know.
Danielle's in Michigan.
Oh, no, I don't.
Yeah. Okay. Well, thank you guys for joining us. We look forward to the next time we get together to talk about medical topics. It's always fun. Thank you for the hearts. And Dr. Vaughan is sincerely touched by all of the hearts. I can see it on his face right now. Yes, thank you, Daniel. So until next time, this is Dr. Mark Vaughan telling all of you to stay in good health.